I'm coming from a background, a working class background, all black, and I'm suddenly in a medical environment where there's a large, predominantly white and Asian background, and I'm seeing a patient that really reminds me of my past in many ways. So it's not only just this academic connection, there's this personal connection to it. And so you have this story. So every time you learn about diseases, it's like, well, it's more common in black people, and black people who get these diseases do worse. But for me, the follow-up questions were why? Why is that the case? And what can we do about it? It seemed like I couldn't get answers to those questions when I talked to the professors. It seemed like it just wasn't something that they could offer any explanation for. And so this book is largely a journey to try and figure out some of those answers for me, for myself. And so that's one really big part. There's two big goals of the book, and that's one really important part of the book. This whole issue of the poor health in the African American community, what that's all about. And so in the book, I really lay it out in three different layers. So there's the layer of what I call the system or society, and how that impacts the health of black people. So we all know that black people are more likely to be poor, more likely to live in communities that are segregated, have less access to medical care. So these are all huge factors. So in the book, I don't just talk about it in abstract terms. I actually use real examples of real people and my real experiences to really illustrate that. So as a medical student, during my third year, we went out to a clinic. This is in North Carolina. So we went out to a charity clinic about 90 minutes away from campus. It's east of campus. And it was an arrangement we had where you would go out there once a month and you would take care of people who, it was like a charity clinic. And so the patients there were all African American. So this town actually was about 50-50 in terms of black and white, but the patients you saw were all black. They did not have health insurance. And it was really clear as you got out there that the kind of care you wanted to provide, you couldn't. It was substandard in a way, despite your best intentions. The patients didn't have health insurance. And so the tests that you wanted to order, the medications you wanted to prescribe, all these things you really couldn't do. Or if you could do them, it was like in the sort of the most kind of substandard way. And so it was really obvious experience that I saw. So that was in a rural setting, and that was in a rural community. And so that was one experience that I talk about. And in there, I really sort of talk about, there are a couple of patients that I really highlight. There's one woman in particular, I describe her, I call her in the book Tina. And so she was a 40-year-old woman, and she had high blood pressure, and she also came in with, she was having bleeding, she was having like excess bleeding after her menstrual periods. And so the cause of this was something called fibroids, which is a condition that is common in African American women. And so what she needed was medication to treat that, but she also needed some sort of medical attention to address this problem. It can be a really serious problem. And so here we are in a clinic with a woman who has no health insurance. And we came to the clinic with samples that day, but we ran out of the samples. And so we weren't able to give her any medication to treat her. And her high blood pressure was very high, and she was unaware of it. And so here we are with this woman who has really preventable health problems. Fibroids are very treatable. High blood pressure is very treatable. And we were left sort of, well, what can we really do for you? And so it was this really stark illustration of how this played out.